Hello, this is Irwin Ironstone. This is Justice in America. And along with that, justice is what you can afford and not necessarily equal for all. Today, the topic we're going to go over is why do pharmaceutical drugs cost significantly more in the United States than in almost every other country in the world. And the article is based on a blog by Senator Bernie Sanders of Vermont, and the topic is why do we pay more for drugs? You sick of big pharmacy greed? That's what this is about. Americans are dying. We can and we must import cheaper drugs from Canada or other countries. We make the drugs in other countries, and the making of those drugs is supervised by Food and Drug Administration, who have on-site inspectors to ensure that the quality of the drugs are what we expect. Drugs are made in Canada, they're made in India, they're made in China. And if you go to buy the drugs in any of those countries, they're significantly less than what you would pay if you were getting them in the United States. Sometimes 200 or 300% less expensive. You can buy some drugs for $3 in India, and in this country they're about $1,000. The reason for that is big drug companies are charging as much as they can in America and getting away with it because of our system. The government is out of control by not limiting the amount of profit that these companies can make. I guess it would be interesting to say that we're sick and tired of getting ripped off by the pharmaceutical industry, which, next to Wall Street, is one of the most powerful and greedy forces in our country. And they pay a significant amount of money lobbying for reduced drug rates, less testing, and so many other things, and they effectively buy our government. Senator Sanders is saying that every day his office hears about Americans who can't afford their drugs, and they have to sometimes choose between buying food or buying drugs. And the result is they scrimp on the drugs, sometimes taking half of a dose, and when that happens they can get sick again and frequently wind up in the hospital again. And all of this can be avoided, or most of it can be avoided, if the cost of the drugs were less than what we pay now. One of the things that happens in this country is that cost of drugs and other things associated with medical supplies drives more people into bankruptcy than any other thing in the country. There was a Harvard study that it's the biggest cause of bankruptcy, representing about 60% of all personal bankruptcies. And that was on the web. If you Google, I guess, bankruptcies and drugs, or possibly Harvard study, you'll find the same thing that I found. One woman said that her family couldn't sleep in their car anymore, and they lost the house because they had to sell the car and her wedding ring to pay for prescription drugs. Today, the American people are beginning to ask questions that need to be asked and answered. It's taken quite a while for this to happen, and I think both presidential candidates, Donald Trump and Hillary Clinton, had as one of their goals to reduce the costs of medication to Americans. Hasn't happened yet, and we're waiting for the president and Congress to do something about that. Drug companies have been increasing the prices of their drugs. Sometimes drugs can double or triple in price overnight, literally from one visit to the pharmacist to the next. Evidently, Senator Sanders is in Vermont, so the things that he hears are people crossing over the border and getting drugs in Canada, and the drugs there cost sometimes a third, sometimes a quarter of what people pay here. And I guess in the northern states, people are doing that because of the savings that they can get by just getting the same bottle of drugs manufactured wherever, but for literally less than half the cost that they pay in American pharmacies. There was a quote, in the last 20 years, the pharmaceutical companies have spent about $3 billion in lobbying Congress. That comes out to about $150 million a year to ensure that, quote, we can't import drugs from other countries, drugs get into the market without proper testing at times, but they effectively buy Congress. They have the lobbyists. They have the equivalent of 13 or 14 lobbyists for each senator who's sitting in Congress. And they do that because, as I said, they spend huge amounts of money. Sometimes, I think there was one case where California tried to reduce drug costs by passing a referendum that said they wanted the state to pay what the Veterans Administration paid. Pharmaceutical companies went in there, bought up advertising, and that bill was defeated. But again, huge amounts of money went in there to lobby so that didn't happen. One of the things that I think each of us has to do, we elect lots of people to the Senate and even to the state Congresses. We have to ask them, what are they going to do to reduce costs? And a lot of them will say, well, it's a national issue, it's not a state issue. And to that I say, if California can try to pass a bill to limit the costs, so can every other state. Even if it loses in some states, it's going to win in others. Another interesting factor is evidently the Veterans Administration can negotiate prices for drugs. However, somehow, the way our system works, Medicare can't negotiate independently, and because of that, the prices are significantly higher. There's some discount when pharmaceuticals sell to pharmacies and give them a discount. Medicare does get a discount, but nowhere near as significant as it would be if, in fact, they negotiated. Because of the size of Medicare and the government, they can negotiate for much better prices. There was one point where it said that the 5 largest drug companies made $50 million dollars worth of $50 billion worth of profits. It's about 10 billion each. And it also pointed out that the chief executive officers of the 10 largest pharmacies made about $30 million a year in salary. And their salary is based on incentives. About the top 10 pharmacies, chief executive officers made 30 million or so a year. One of the ways they do it is their salaries include bonuses based upon how much the company makes. So the more the companies charge, the more they make. This is from the article, or from Bernie Sanders' tweet. Chief Executive Officer of Gilad, John Martin, became a billionaire because his drug company charged about $1,000 a pill for hepatitis C. If you went to India, the cost of that pill would be $4 a pill. Question is, why should we as Americans being basically gouged by pharmaceuticals? And I think that's something we have to ask Congress, and I believe there's an ability of the president to draft an executive order to allow Americans and not pharmaceuticals, but pharmacists or wholesalers to get drugs from other countries where they're much less expensive. And again, I don't know what our current president is waiting for, and I don't know why Congress, the leaders of our country, don't do something about it. Today, pharmaceutical companies are increasing their profits because Congress has done nothing to stop them. Their goal is to make as much profit as they can. The company's presidents get paid bonuses based on the profits, so obviously, rather than reduce the costs to Americans, they increase the costs, and sometimes they double or triple. And although there have been a few newspaper articles about that, we have a very large problem in this country because Congress allows this to happen. And there are ways where we can reduce the costs, but it's just not happening. The article said that Senator Sanders and a few others in Congress, and it was bipartisan, tried to get the Affordable and Safe Prescription Drug Importation Act passed. And again, there's a lot of lobbying, and many of the pharmaceutical companies basically buy our politicians. They contribute millions of dollars to congressional races, and the people who are elected are beholden to them. And that's why we as a general public have to pay so much for our drugs. If the law would have passed, or if it does pass in the future, it would mean that large pharmaceutical chains, wholesale distributors, and even individuals can get mail order drugs from approved pharmacists. And I know they say that we can't control internet pharmacies, but a lot of the pharmacies, or the pharmacists, or the drug companies make their drugs in other countries, and the making of those drugs is supervised or monitored by Americans from the Food and Drug Administration. The article went on to say that the American government would save about $6 billion if pharmaceuticals or drugs were less expensive. That's a ridiculously low figure. The figures are really in, I'd say, the hundreds of billions of dollars each year, and I'll go over that in a short period of time with some examples. When this type of legislation comes up, I guess the drug companies usually advertise on television and try to tell the public you can't get them drugs overseas because you can't control the source. But the answer is, we're doing it now. Most drugs are in fact manufactured overseas. I think the way it works now is 40% of all drugs that you take can be imported from foreign countries. In addition, 80% of the chemicals or elements that go into making drugs come or can come from overseas, and that's what's happening. And they're charging us rates that are outrageous based upon cheaper labor and factories that they've built overseas so they can gouge us. Now, obviously, we're not the only country that's paying large amounts, but we are, in fact, the country that's paying more than any other. The Washington Post evidently rallied or tried to say that it was not proper for the drug companies to buy our government, but it's still happening. And one of the things that happens is, in advertising, the drug companies get medical prostitutes, people who vouch for the safety and the genuine drugs or the branded drugs over the generics. Now, again, these, I call them professional prostitutes because they're selling their souls to get paid, and there should be some disclaimer about what they're saying, because they're very frequently bending the truth. Actually, they're lying about what happens if you buy drugs on the internet with an FDA-approved pharmacy. No one in Congress is going to tell you, we're going to allow you to buy drugs that aren't safe. They'd be crazy. They'd never win another election again. So instead, they try to pass bills, and the lobbyists tried to prevent those bills from being passed. And it's easy if you buy half of Congress, and it's not just the Democrats or the Republicans, it's both parties. They effectively have a rigged roulette wheel, because they buy members from the Democratic Party and they contribute to the Republican Party to ensure that we don't control drugs or the costs of drugs that Americans pay for. Same thing has happened with some other chemicals. Monsanto is known for a lot of agricultural chemicals, and they too have bought Congress so that Monsanto is considered risk-free and can't be sued in this country based upon Monsanto basically has genetically modified foods, or basically seeds, and they sell them all over the world. And Congress has passed a bill, I wonder why, that makes Monsanto risk-free. As I said again, congressmen would not include anything in a legislation that doesn't in fact include safety measures to ensure that the drugs that we get as Americans are up to snuff and are manufactured in a way to ensure safety. The debate isn't really about the safety, it's about how do you limit the profits from these pharmaceutical companies, and how do you basically, how does Congress allow Americans to get cheaper drugs? There was an example that was used, but I'm just going to give one or two. Crestor is a drug that's used for high cholesterol, and in the United States, a 3-month supply was about $780. In Canada, the same drug was about $200. Now, that's more than 3 times the cost in America as in Canada. Now, they give me a bunch of other drugs. Another one is Abilify. It's a drug for bipolar disorder, and there in Canada, the drug costs about $540 for a 3-month supply, and in our country, it's about $2,800. In that case, it's at least 4 times the cost in the United States as it would be if you bought it in Canada. Not only are drugs very expensive in the United States, just about anything else is also very expensive. Whether it's medical devices, whether it's hospital stays. I think we as a country have the highest costs of hospital stays in the world. Most of the costs are half of what we pay, sometimes even less than that. And it's time we looked at not only pharmacies, but hospitals and private corporations, nonprofits who still charge a huge amount to your insurance company or to the government, and medical devices. Also, I guess there's a certain amount of fraud in the medical profession. Occasionally, I think they've gone after that, and that's saved billions of dollars over a period of years. But it certainly shows that we do not have professionals who follow the rules all the time. A survey, about 70% or so of Americans favored the idea that they should be allowed to buy drugs in Canada. I think it's the Kaiser Family Foundation did the survey, and I guess it's significant. Going back just a little bit, one of the other figures, a day in a hospital here can sometimes cost $3,000-4,000. If you stayed in the hospital in Spain, it would be about $400 to $600. Huge difference in the costs. The bill, according to Senator Sanders, will basically allow us to buy drugs more inexpensively, not cheaply, and the drugs will be safe because we have Food and Drug Administrator inspectors and basically monitoring foreign manufacturers. So the drugs are effectively the same drugs that we take here. Problem is that once they're imported, somehow the price is raised and Americans are being overcharged by huge amounts. One of the things I'm going to read from a list now of things that we should consider. Why don't we have legislation that limits the price of drugs so that we're not paying significantly more than the highest price in any other country? Why not use the highest and lowest prices in countries and average them in so that we get a middle range price? And I guess one of the reasons is if we took that approach, uh, the pharmaceutical companies would stop selling drugs in countries where the price of the drugs are less expensive. And we would hear about rich American companies cutting out drugs from places where they would be more affordable. I basically gave one example where the drug for hepatitis C, a pill costs about $4 a pill in India and about $1,000 in this country. That can't go on. I also did some calculations, and I took the maximum amount that Americans pay for pharmaceutical for drugs over a year, and that was about, I guess, 2 years ago, 2015, we paid about $350 billion for drugs. Now realize if we save 20% of that, it would be about 70 billion a year, and over 10 years it would be almost $750 billion. That's only at a 20% rate of savings. If we went to 40% and realize Americans are already paying double the prices, the figure would be about 140 billion, or over 10 years, $1.4 trillion. That would come basically from the drug manufacturers, and realize we as Americans, through Medicare, Medicaid, and other insurances, basically are being gouged. And if we, for example, in the Affordable Care Act, if the drugs were reduced, it would mean the whole system would be less expensive. Similarly, if, for example, just a fraction of the, instead of 40%, just those people who were on Medicare had less expensive drugs, we'd still save, over a 10-year period, probably about $1 trillion. What would the cost be of sending drugs into the U.S. from China or from India? And why don't we publish approved companies from those countries so that we can allow Americans to import those drugs? And it, not only we as individuals, but if pharmacies could do the same, or wholesalers can do the same, that would benefit everyone and would result in reduced costs for drugs. Someone asked, I guess, the managers at the pharmacy at Costco if drug companies could indicate where they're being manufactured, because that would indicate in some way the costs. And I guess most drug companies don't have the country of origin on their bottles and won't even give out the country where the drugs are made. Realize also, even if they're made in this country, they can still get 80% of the ingredients for drugs from overseas businesses, and they're a lot less expensive. And it's not just the people who are in the elderly or the poor, it's everyone, because if any type of medical program, government medical program, whether it's a VA, whether it's Medicare, or whether it's the Affordable Care Act, we pay for that through our taxes. So we are indirectly paying to let large companies, large pharmacies benefit. That's not large pharmacies, it should be large drug companies or pharmaceuticals. And we should try to basically to pass laws so that we can in fact get cheaper drugs. Some of the things that the bill included were that the drugs be inspected during their manufacture overseas. They have the same active ingredients, and some drugs like opiates could not be imported into the country. Now, obviously, if one senator is willing to do this, pressure put on the other senators, whether they're Republicans or Democrats, would result in low costs for drugs to Americans. And I think it's important that when we elect, or whenever these representatives are elected, we ask them how they would vote on a particular bill to allow Americans to import drugs, and how would they control how drug companies raise rates without any penalties. Okay, that's the end of this section or segment, and hopefully I'll try to get back with some other stories about our healthcare system. One of them I'd love to look at, and I'm not even sure I can, is nonprofits, hospitals are paying very large salaries for administrators, and the costs of staying in, quote, a nonprofit hospital are still very, very expensive. And that goes into the entire cost of medicine. That goes into the entire cost of medical care in the United States, whether it's the pharmaceuticals, whether it's private hospitals, whether it's nonprofit hospitals, whether it's mechanical devices. All of these things should not cost what they now cost. Now I have to say goodbye, and Peter, come here. And this is my law dog who assists me in many of my adventures as I work through the night. He's a beautiful little toy poodle, and he licks me at night. He makes sure I take breaks and take him out for walks, and he's really a lovely little monster.